So I'm Jason Wagner from Sarasota Vascular Specialists. People always ask me, hey, I'm about to start dialysis. What do I need to do to care for my access? It all starts actually before you have your surgery. You want to make sure you keep protecting whatever the operative arm is going to be. So if you're right-handed, usually it's going to be your left arm. So no blood pressures, no IVs, no lab draws, nothing to mess with the veins, because those veins are what the surgeon's going to connect to the arteries to make your fistula or graft. Once you've had your surgery, you're going to have a dressing, maybe 1 if it's a fistula or 2 if it's a graft, and you want to make sure that those are covered. 2 days at least, then you can take them off usually, shower, rinse the arm, pat it dry. If you have a tunneled catheter in your chest, obviously you can't shower or get that wet. Next, it's going to be just following and reporting any signs or symptoms of any problems to your surgeon. So if you're having arm swelling immediately after the surgery, that's pretty normal. If you start having whole arm swelling or pain after the procedure, that's abnormal. You need to reach out to your surgeon or their office. Long term, if you start seeing kind of bulging or kind of puffiness of the arm or at the access sites, that could be a sign that the vein or the area of the graft that they're sticking is degenerating or kind of starting to weaken over time. You need to report that to your surgeon. The best way to prevent that from happening, good close follow-up with your surgeon, also making sure that the dialysis nurses and techs that are accessing your fistula or your graft are moving the needles up and down the arm. You don't want them to keep hitting the same spot over and over and over again. The graft's not meant for that, your vein's not meant for that, your skin's not meant for that, and you're going to have a problem and it's going to degenerate and you're going to have a big lumpy arm and an aneurysm. In summary, make sure they move the needles, and if there's anything that doesn't seem right, call your surgeon. Thank you.